Hey folks, welcome back to High Intensity Health Radio. It's your host, Mike Mutzel. Thank you so much for tuning in. Today we're live with Dr. Brian Mowll, and we're going to talk about diabetes. And he's the perfect one to explore this topic with because he's hosted this wildly successful summit called the Diabetes Summit for many years now, and it's coming up very soon. He's a certified diabetes educator, and he's also certified as a certified functional medicine practitioner. So Brian, thanks so much for being here.
Yeah, thank you. And I know we did an interview with you for the summit, and we talked a little bit about the IFM and the process of going through that. It's a great program, and I'm excited to share some good information from a functional medicine perspective. We look at diabetes through that lens today.
Love that. Yeah, that's a great launching place. And a point that I wanted to bring about this is there's multiple, ways that people can get diabetes. It's not just eating too many carbohydrates, and so that's what I wanted to kind of launch with is, first of all, the prevalence of diabetes is much higher and the prediabetes is much higher than a lot of people really understand or recognize. And there's multiple causes, that people are not really looking at, like sleep and toxins and stress. So give us an overview, if you would, Dr. Brian, about the overview of prevalence and then the multiple causes that people may not recognize.
Yeah, prevalence is insane, literally insane right now. I mean, it really has become a pandemic and a global pandemic at that, not just a US phenomenon. We thought for years that this must be just an American thing because, of McDonald's and fast food and, we drink too much soda and all that stuff, which there are some links to that, of course, but that type of diet, the Western diet, has now spread throughout the globe. And I think it's more than that. It's the sedentary lifestyles. It's the stress. It's living. We don't have to fight for our food anymore, right? So it's living these sort of cushy lifestyles. I think that unfortunately set us up for diabetes. It's especially places like China and India and other parts of the world where they were very much eating a completely different diet than people from European descent. So now they've got this specific genome that is now getting this brand new diet filled with tons of sugar, tons of processed carbohydrates, flour, not to mention the toxins and chemicals in our food, plus the stress, plus the lack of exercise. And it's just the perfect storm for diabetes. So there was a study back in September of 2015 published in JAMA, the Journal of the American Medical Association, that said now 50% of the US population has either diabetes or prediabetes. 50%, that's half of us. So you look around and half the people you see are walking around with diabetes or on their way to becoming diabetic. And that's what I mean by insane. It's crazy. If that was cancer or any other disease, I mean, it'd be amazing. And there's links to all these other diseases too. So it's pretty crazy right now.
Yeah, that brought up something that I wanted my pet peeve, as it were, with diabetes and so forth, and just general practitioners, right? Your internal medicine practitioners and the family medicine docs that aren't yet, exposed to all the research that we know to be functional medicine or systems biology. Someone comes in for an annual physical or one-time checkup, and their blood sugar is 98, for example, or 102 or 104. And that's it. They go back a year later, and so the doctor may say to that patient, well, you're falling into this pre-diabetes window. We'll check on you next year. Avoid the carbohydrates. And so, I think the prevalence maybe even be more than 50%. So what do you recommend for it, like testing, assessment? Like people are listening, like maybe I'm one of those 50%, right? How do glucometers, like on a regular basis? Like what do you like? So that people should take action and be a participant in their own health. How should they assess their blood sugar?
I think everybody should buy a glucometer. I mean, they're cheap, they're easy to use, and if we could test our thyroid hormone levels or our testosterone with a finger prick, I mean, I don't know, maybe not many people would be doing, but I'd certainly be doing it. You probably would be too, because that information is so good to have at hand. And we can do it with glucose. So I think everybody should own a glucometer and be testing their blood sugar. You don't have to be crazy with it and be testing 4 and 5 times a day if your blood sugar is just slightly elevated. But you want to know. I can't tell you how many people found out they had diabetes with a blood sugar of 300 or 400, and it had been maybe 2 years prior, it had been 110. So they had no idea. And the reason they have no idea is because they're not testing. So you can buy, the one I recommend is called the Neo. It's a company called Abbott that makes the Freestyle Light meters, which are notoriously the well known as the most accurate meters, the most reliable meters on the market. And they came out with one for people who don't have insurance or don't have the diabetes diagnosis yet, where insurance doesn't pay for it. It's called the Neo, and you can get it at most major pharmacies. It's about $20 for the meter. The strips, which are really the expensive part, you can get a pack of 50 for right around the same cost, like $20, which is not expensive at all for something that is that valuable. And then you can check your blood sugar. You do it in the morning sometimes. I think the most important time to check is after you eat. So it's postprandial, which means after eating, blood sugar, blood glucose levels, which are the ones that are the most dangerous. These are the ones that will rocket your hemoglobin A1c, which I'll talk about in a second, up. And that's a sign or a test of glycation or a form of oxidative stress that ages us faster and causes all the diabetes complications. And you don't have to have diabetes to get these complications, right? So maybe your blood sugar is 110, 115, and it never goes above the magical number of 126 to get that type 2 diabetes diagnosis. That doesn't mean that that's okay. You've still got extra sugar floating around in your bloodstream, doesn't need to be there. And that sugar is going to basically caramelize or sugar coat the proteins around nerves in the endothelium of blood vessels, the brain, kidneys, the small blood vessels in the hands and feet and sex organs. And all this glycation damage is ultimately what's going to lead to a dysfunction in the body, sexual dysfunction, dementia, poor circulation, neuropathy or nerve issues. And a lot of times people don't make the connection, but that's oftentimes what's causing it. So get a blood sugar meter, test your blood sugar. If it's creeping, really over 100 for sure, because normal blood sugar is about 83. So somewhere between 80, 85, somewhere in that range. And it does vary just a little bit, but certainly if it's up into the 90s or over 100, then that's something you really need to be paying attention to sooner than later.
Mm-hmm. I'm so glad you mentioned that. I mean, what you can't track, you can't improve. And so people are just kind of flying willy-nilly, driving behind. There's no vision. There's no accountability. So I've been doing this glucometer thing for about a year, and it's so awesome because you can see like nights where I stay up too late working because I have a project or a deadline, or if I'm traveling or I'm stressed, my blood sugar the next morning would be like 90 sometimes, and other times when I'm meditating before bed, I do sauna, I do a lot of lifting weights and cardio, it's like 72, and so like really gives a nice feedback so that you realize, these lifestyle factors, whether they're good or bad, how they influence your blood glucose. So let's talk about cut points, if you will, like thresholds, like so post-meal. I know there's like the glucose tolerance test and so forth. What are some realistic numbers for people if they're like, okay, I'm going to, they forget to test their blood sugar right away. Should it be 30 minutes, 90 minutes? Like, what do you tell people? Or do you have any handouts for them?
Yeah. So from a diabetes diagnosis perspective, blood sugar should never go over 200. And that's obviously very, very high, but that's if it's ever over 200 at any point, that's a diabetes diagnosis. So we don't want to see it go that high. Postprandial blood sugars, my opinion is they should stay within about 20, 30 points maximum of your preprandial before meal blood sugar. So if I'm going to really test this, I like to do it before and after. So you can't just sort of assume that whatever it was in the morning or what it was in the morning 3 days ago is what it was right before you ate, because exercise sometimes can drive it up, stress can drive it up. There's other things that you might be dealing with that could cause slight elevations in blood sugar or not so slight. So you check it before. And if you want to see what the actual meal did to your blood sugar, I like about an hour after. So about an hour after you eat, you check again. Oftentimes you'll hear 2 to 3 hours. And that's a good test to see how your body's sort of recuperating, right? So your blood sugar should be back down to baseline within about 2 to 3 hours. And that's a good test for glucose control, right? Or glycemic control. So you want this, because diabetes is not just high blood sugar, it's also how you regulate your blood sugar. So you may, maybe your blood sugar doesn't really even go that high. So let's say you check it before you eat and it's 95, and after you eat it's 140. And so it doesn't spike up into that 200 range. But let's say you check it 3 hours later and it's still 130. You're not recovering well. So your insulin, glucose metabolism balance isn't working. So that's not diabetes, but it's a sign of glucose intolerance, which is another form of sort of pre-diabetes, and it's still a problem. That's the key. It's still a problem. So you can check 2 to 3 hours to see what your glycemic control is like. That's an interesting thing to do. But if you want to check the food, like let's say you want to test how do I respond to a sweet potato, with some ghee on it or something, and a little cinnamon. Some people do absolutely fine with that. Some people don't. If you check before and let's say it's 90, and then afterwards it spikes up to, like I said before, 140. That's too high. So that food is probably not a good idea for you. That's creating toxic levels of glucose in your bloodstream, which is going to have a negative impact on your health. Where maybe a bowl of broccoli and a side of fish or something, you only go up by 10 points. So you can actually do some experimentation like that with yourself, because we're all different. Our physiology is all different. How we handle certain foods is different. A food might be a real food. It might be healthy for many people, but if you have blood sugar dysregulation, it may not be great for you at this point.
Mm-hmm. It's so fun to play around with this, Dr. Brian. I mean, one of the things that I've been experimenting with is the ketogenic diet. And so then post-meal, I'll have, a good-sized lunch with like grass-fed beef and, like you mentioned, like broccoli and garlic and ginger and stuff like that. And your post-meal blood sugar would be like 87. And so that you're thriving on ketones. And so it's really great. It's a great way to eat better. I mean, we always have eaten real food and close to the ground and go to farmers markets. But now that we test our blood glucose on a regular basis, we eat so much better. So it's that awesome feedback.
And real quick, Mike, I forgot to mention that if you have normal blood sugar metabolism and you eat a good low carb or ketogenic style meal like that, you're not going to see any blood sugar change, or it might actually go down. So that's really what should happen. I check my 14-year-old's blood sugar sometimes, and he can eat a lot of things that I can't eat, and his blood sugar still doesn't budge. So healthy blood sugar metabolism, like body temperature in a way, will stay pretty tightly controlled.
Mm-hmm. So do you worry, Dr. Brian, about elevated fasting as much, or are you more concerned, like you talked about, because this post-meal, this postprandial spikes, that's really where the glycolytic damage occurs. So where do you weight the fasting elevations?
I just don't want to see it ever go too high. So some people have what's called the dawn effect or dawn phenomenon, where their morning reading is actually the highest. And so sometimes we'll have them test before dinner, especially if they haven't had like a mid-afternoon snack. So you need about 4 hours of no food. So you're out of that fed state. And then you check your blood sugar right before dinner. Compare that to the morning fasting reading. And that'll give you an idea of whether you have that hormone effect in the morning, that dawn effect, because you might, let's say you're just checking in the morning and your blood sugar is 95, 96, 103, and then you check that before dinner reading and it's like 80, or 82. Then that morning rise is really, it's not your baseline. It's due to some hormone influence. Not that it's okay. It's sort of a different problem. We still have to deal with it, but it gives you more information. So if you're, so that I call the pre-dinner reading sort of the second fasting reading. It's, you've only been fasting for about 4 hours or so, but it's still sometimes a better baseline. So to answer your question, sometimes people will have a very high reading in the morning. Like I've seen people who have a blood sugar of 180 or 160 or 140 even in the morning. And obviously that's a problem. If your blood sugar ever really goes that high, then we need to do something about it. So that's where I get more concerned about that morning fasting reading. The other concern, of course, is if you're starting at, maybe it is 110 or 115, if you're starting there and then eating on top of that, right, and then your blood sugar is going up 30 points, now you're up into that danger zone again.
Really interesting. So is there different subtypes? I know that's something that you want to kind of take a deep dive in, that those people that wake up with a high baseline, is that a different subtype? And then how, I guess, would that affect treatment? And then maybe what advice would you have for someone like that?
Yeah, it's a great question, because I think a lot of these things just aren't addressed conventionally very well. They sort of look at that morning high and say, oh yeah, that's the dawn effect. And they really don't do anything about it other than now they have a name to sort of explain it. But I think it really needs to be treated differently because not everybody has that. I find it's about 40% of our patient base, client base has that. And there's different things you can do to handle it. And I do think it's part of different subtypes. So, for example, we categorize people with type 2 diabetes into 4 subtypes. And the most common one is a type O, which is typically overweight, highly insulin resistant. It makes up probably about 50 to 60% of people with type 2 diabetes. So it's definitely the most common. And they may or may not have that morning dawn effect. So it is a possibility for them as well. But the key there is, again, it's all about insulin resistance. They've got high insulin levels really throughout the entire day. I've had people, type O's, fast for 48, sometimes longer hours, and test their insulin, and it's still high like 2 or 3 days later. So their insulin just never drops. And in fact, fasting is one strategy that we will employ sometimes for them, because after a while, fasting will eventually reset the insulin levels. And there's other ways, like a ketogenic style diet can do it also. But that's the real key there, is they're hyperinsulinemic. They've got too much insulin in the bloodstream, and it never comes down. So, it'll come down, but it never comes down to a level that's normal to where they can actually start to burn fat effectively without changing their diet significantly. So that's type O. The other side of that coin is a type I, which is sort of your thin type 2. Now, this is not type 1 diabetes, but it's kind of similar to type 1. Type 1s typically, if they don't take insulin, their blood sugar is really high, like 300, 400, 500 range. So these people can maintain a blood sugar without insulin, without external insulin use, that's, sort of diabetic range, so 150 to 200. They're not type 1. They still have some beta cell function. Those are the cells in the pancreas that make insulin, but they're not making enough insulin to keep up with whatever diet they're eating. So they tend to be actually thinner. Insulin puts on weight. So when they have a lack of insulin, they're thinner. That's why type 1 diabetics are oftentimes skinny, because they don't, especially if they're not, sort of before they get diagnosed, they're not taking insulin, they're not making insulin, so they can't keep any weight on. So they tend to be thinner, and oftentimes will have an autoimmune component as well. So there is some damage to the pancreas done by the immune system there. And again, you can see how that type of person would need to be handled very differently than sort of the overweight type 2 insulin resistant diabetic. But unfortunately, conventionally, they're handled exactly the same. They're both called type 2 diabetic. They're given the same medications. The skinny one might be put on insulin early, but that doesn't usually help all that much for them. And then there's 2 other subtypes which are kind of different. One is hormone type, and that specifically seems to be low thyroid function and low adrenal function. So these folks are sort of adrenal fatigue or adrenal dysfunction on the low end, low cortisol production, and definitely have low thyroid function. And that has a huge impact on the metabolism, of course, which we're not burning sugar. It can raise blood sugar. It can raise things like triglycerides and free fatty acids in the blood, hypothyroidism, which then can cause insulin resistance, and it's this whole other cascade. But the key there is it's really the hormone imbalance is the driving force. So again, I can't tell you how many. It's probably 30% of our clients come in are hypothyroid, and maybe they're taking some Synthroid, but their thyroid levels still aren't optimized. They're all over the map. It's not really being taken seriously, and they're just being treated as a type 2 diabetic. And this thyroid thing over here is sort of being ignored largely. But that really is the primary thing to focus on in those cases. And then the last one we call type S, which is sort of the stress-driven. Not always, but these people tend to be sort of the type A personality. Again, it's the kind of guy you would look at or lady, and you wouldn't think they would have diabetes, and in fact, when they get diagnosed, they're usually embarrassed. And that's a cardinal sign for me. They don't want to tell anybody they have diabetes, and they're sort of like, how did I get diabetes? But it's oftentimes related to all the things that can drive stress. So that is, yes, it's mental, emotional stress and overworking and being overwhelmed, but it's also poor sleep, right? Gut dysfunction. We talked on the Diabetes Summit. You and I had a great discussion about the gut and dysbiosis and all the hormones that are made in the gut that relate to diabetes and blood sugar. And certainly gut dysfunction can drive stress big time. Chronic musculoskeletal pain can drive stress. Things like chronic blood-borne infections like Lyme disease and Epstein-Barr, and gut infections, parasites, candida, and other infections like that can drive stress. So again, in a type S, the key there is that, again, that is the driving force. So a lot of times these folks will come to me and they're on a sort of a paleo diet. They're on a low carb diet. They're exercising. They're doing all the things that they're supposed to be doing, but they still can't get their blood sugar down, and they're frustrated. They don't understand what's going on. They feel like cheated by life, and but there's always, we know from functional medicine, right? There's always a cause, right? It's just finding those puzzle pieces that fit together, and for them, it's that stress piece.
That's huge. I think we'll talk about some of the treatments towards the end, because I want to kind of bundle all that. But you hit on something, Dr. Brian, that I think is a key biomarker. In addition to the at-home glucometers that we're recommending, the blood sugar testing on a regular basis, but elevated triglycerides. So a lot of people the body kind of compensates, and unbeknownst to a lot of folks, converts sugar to fat. So talk about that. And that was something that I would use, in clients that would come to me, and they had quote unquote normal, relatively low hemoglobin A1cs, like 5.9 or 6.0, but their triglycerides were like 160, 170, 180. And so we know that they're on that path of prediabetes. So what other biomarkers, in addition to triglycerides, do you like to look at, and give us your insight on that?
Yeah, great question. And triglycerides are really important. I think it's really one of the main metabolic tests that we can do that's easy to do. It's cheap. It's pretty much on every standard lab order. So triglycerides, glucose, and hemoglobin A1c are sort of the first three things that I look at. Hemoglobin A1c is oftentimes not done if there's not a suspicion for diabetes. But again, it's one that I would ask for. I think it's important to look at, because it can creep up just like blood sugar can creep up. And the thing I love about that test, before I talk about triglycerides, is that the hemoglobin A1c it's described as a sort of an average blood sugar, a 3-month average of your blood sugar, but it's really more of a surrogate marker for blood sugar. What it's actually telling us is how much damage is being done by high blood sugar to the red blood cells. And that's important, because if there's damage being done to those red blood cells, then you can count on the fact that there's damage being done to your large blood vessels, your small blood vessels, your nerves, your brain, your kidneys, and all your other organs. So the hemoglobin A1c is basically a damage indicator. Which to me is more important really than just knowing how your glucose is, because if your glucose is up and down and up and down and up and down, but you have a good A1c, there are a few situations where it's not accurate, like if you have anemia, for example, or another, they call them hemoglobinopathies. So some sort of defect in hemoglobin production, because it's measuring the the A1C receptors on hemoglobin. So if, for example, if your blood vessels are too large or they live longer than the average person, that can start to change the range of a healthy A1C a little bit. But we're talking a pretty small percentage of people. So for the average person, the A1C is a really good indicator to tell us how possibly those blood sugar peaks and valleys and spikes after you eat that you don't know about because you're not testing, how those are affecting the cells of your body. So I think everybody should get that. We really want the A1C between about 4.5 and 5.5. 5.5 is getting a little high. Most healthy people that I've tested are around 5. So, and sometimes like 4.7, 5.2, somewhere in that range. So we want that A1C right around there. And people with diabetes are like, what? You know, because they're used to seeing an A1C of 7, 8, 9, 10 or above. And in fact, the American Diabetes Association just says 7's good enough. You know, keep it around 7 or so, and you're fine. Which is crazy because think about it. If normal is 5, I mean that's 2 points higher. Research shows for every point you're adding about a 15 to 18% greater likelihood of complications. So you know you're already at 30% greater likelihood of developing blindness, kidney failure, cardiovascular issues like heart attack, stroke, neuropathy, sexual dysfunction, dementia. So really you want that A1C down, you know, certainly under 6 and preferably around 5. And again, that's for everybody. So we can all have that tested. It's not an expensive test. You just have to ask your doctor to order it, and hopefully they're friendly and they'll do it. If not, go to like a Direct Labs or something. You get it for like $20. So the A1C is important. The triglycerides are the other, I think, metabolic test I think is really good. Now, there's lots of tests, of course, that we can look at, things like organic acid test, mitochondrial function and detoxification. We can do advanced lipid markers where we look at particle size and number and lipid, different atherogenic particles and things in the bloodstream. But triglycerides, simple, easy, cheap, and it really gives you a lot of information. So if the triglycerides are high, and that's really above 70, then it's an indication that your metabolism is just really not working very well. You're not burning fat effectively. Your fat furnace is sort of turned off, and you're probably burning more sugar for fuel. Of course, we're all burning fat and we're all burning sugar, but you're burning more sugar. You're sort of depending on glucose rather than burning those fatty acids. And so what that means is that fat, free fatty acids, form a triglyceride, which is a glycerol and 3 fatty acids. They form this little bond. And the fat is building up in your liver, and it starts spilling out into your bloodstream. And that's the triglycerides start to go up. So triglycerides are, like, people think of serum glucose as blood sugar. Triglycerides are like blood fat. So you've got this extra fat building up in your liver. It's spilling out into your bloodstream. And now not only are your blood vessels and organs getting sugar coated, but they're getting sort of fat coated too. And that causes insulin resistance, which leads to diabetes. It causes obviously issues with weight, belly fat, and so forth. So what you want to do is, like a good ketogenic diet, like you're following, Mike, or even a good low carb diet where you're cutting out most starches and sugars and other forms of carbohydrates, except for fiber. Fiber is pretty good. And then even fruit, because fructose, as I'm sure your listeners are probably aware of, can drive the production of triglycerides in the liver. So if you've got elevated triglycerides, the fruits should really go as well. And you want to allow your body, or encourage your body, to start burning the fat that you're eating, like coconut oil and avocados and smart fats from vegetarian sources, and the ones included with proteins. And if you're overweight, obviously encourage your body to burn your stored fat. Interestingly, when people are overweight and they start burning fat more effectively, sometimes we'll see the triglycerides go up for a while, but then eventually they start to come back down. So a lot of people on that 3-month first blood test, they say, oh my gosh, my triglycerides are higher, my cholesterol is higher. But if we look at it, the ratios are still good. And if they've been losing weight, then we say, well, don't worry too much about it. Let's give it another 3 months. And by then, 100% of the time, their triglycerides are way down if they've been following the diet. So the triglycerides, in functional medicine, we kind of know if those triglycerides are up, it's sort of the test to tell if they've been eating too many carbs, right? The triglycerides don't lie, because when you're eating too many carbs, those carbs get turned into fat and the triglycerides go up. And so that's how we can determine if someone's really insulin resistant without doing like a clamp, which is what's done in research, which is ridiculous. Obviously, nobody's going to do that. So we look at fasting insulin levels. If they're high, we look at glucose and A1c, and then we look at triglycerides. And if you got one or two or all of those, that's insulin resistance for sure.
Yeah, I love your approach, Dr. Brian, because a lot of people, I think, get a little trigger happy with testing, and they want all the tests in the whole wide world and stuff. But a mentor of mine, Gerard Guillory, was always trying to tone me down and say, Mike, look, if the test is not going to change the treatment, then why spend the money on the test? And so that's what you're talking about here, is like, go inexpensive and high hit rate. So hemoglobin A1c, triglycerides are awesome because, like you said, I mean, standard chemistry laboratories, whether it's Quest or LabCorp, these boutique labs, generally do those for very inexpensive. But the point that I want to make here is a lot of physicians, if they're not functionally trained, will overlook elevated triglycerides. They're going to say, oh, 120, 130, yeah, you're okay. You're fine. The lab range is what? I think the cutoff point or the high point is like 200 or 180, right? So you're under the, the pathological reference range. So you're seemingly healthy, which we know not to be true. But Dr. Brian, let's transition a little bit into therapies that are effective. We kind of touched on ketogenic diets and low carb diets. We know stress management's a big deal. We've talked about exercise before, the microbiome. If you could prioritize like the highest hit rate and most effective lifestyle therapies for the different subtypes or for people in general, where would you start and introduce people to?
Well, I think it starts with a really good functional medicine assessment. And you just mentioned testing, which can be a lifesaver, can be great, and can give us some really good information. But I don't think anything beats a good functional medicine workup, right? So you actually sit down, talk to the person, listen to them. It's a lost art in medicine, but you actually listen to them, have them fill out forms or whatever helps. But basically, then you just start piecing things together. And it's amazing. You just sit down with a file and look at the story that they just told you. And you go, oh, yeah, now I can start to see. And then they can start to see what's sort of driving or what drove the dysfunction from the beginning. It doesn't always jump out off the paper. Sometimes that's, obviously having a skilled practitioner is helpful. But you can learn so much just from that story. So you start there. If you need other tests, you do other tests, obviously. But then we allow the patient's story, condition, subtype, testing to determine what that treatment's going to look like. Mm-hmm. Some people, it's all, we just got to go after healing the gut right from the beginning. Others, it's oftentimes with stress, these people are the ones who they want the diet, they want the supplement or the pill. The last thing they want to do is address their stress. but sometimes if that's the thing, then it's got to be dealt with. And that might mean cutting back on work or finding a way to incorporate some meditation or relaxation techniques or whatever it's going to be. But and there are supplements like adaptogens and herbal formulas and things like that can be helpful, but really it's hard to medicate a bad lifestyle. It's hard to supplement a bad lifestyle and make any significant change. So it really starts with a good diet, good lifestyle. Physical activity is really important. There's a few basics. So the sort of the 5 basics that we look at are a good low carb diet. Ketogenic style diet is great. It's hard sometimes for people to do right out of the gate. So, we usually start sort of low carb, and I always have people just count their carbs first, so we kind of know where they are. If they're eating 300 grams of carbs a day, I'm not going to ask them to go down to 20, so it's, but at some point we probably need to get down below 50 grams a day. That's sort of our general recommendation. And then it becomes really, what can the person tolerate? So 50 grams might be good for the average person, but most people aren't average. So somebody might be able to handle 75, somebody might only be able to handle 20. So it's finding that carbohydrate balance. And of course, it's not all about carbs. It's about quality food, clean meats, good quality proteins, focusing on a lot of vegetables. I think our diet should probably be about 75% vegetables, fibrous above ground vegetables. We need to eat a lot of veggies, especially if you have diabetes or blood sugar imbalance, because vegetables really aren't going to raise your blood sugar. They've got a lot of fiber. They're filled with phytonutrients. They're very nutrient dense, not very calorie dense. And certainly it's not all about calories, but I think calories do matter to an extent. And people with diabetes notoriously, especially if they're overweight, notoriously have overeaten at one point in their life. They probably still are. The cure for diabetes before insulin was discovered in the 1920s was cut way down on food consumption and go low carb, high fat, which is sort of coming back now as the preferred treatment. So some of the good dietary methods that you follow, you teach, real foods, healthy fats, clean protein sources, low glycemic sources of carbohydrate like fibrous above ground vegetables, and then lots of water and healthy fluids. Physical activity is a must. Most of us don't move enough. And I interviewed Ben Greenfield yesterday, who's a wild man, and he's on his treadmill desk the entire interview. And he's just like a living example of that. And I try to do the same thing as much as I can, try to just keep moving. It's not about the 1 hour a day or the 30 minutes a day that you exercise. It's your movement throughout the day that's important. And you got to try to move as much as you can. So he recommended, which I love, I'll just throw this in. He recommended after every meal, you get out and walk, 15, 20 minutes, 30 minutes, do some sort of movement after every eating occasion, that's significant. And I love that idea. So I think we need to move. And then there's stress management, which you got to find things that work for you, but things like meditation and journaling and relaxation techniques and healthy baths and things like heart math, which is you can do on your iPhone, heart rate variability training. Sleep is crucial. We have to get better sleep. Sleep is really sort of vital. And then the last one is nutrient repletion. So making sure that we do have the right vitamins, minerals, nutrients that we're getting, especially if we haven't had the best diet over the years, we might need a good 3 to 6 months to replete missing nutrients in our system with some good quality supplements.
Love it, Brian. Yeah, there's so much there to tease out. And Ben Greenfield was one of our first guests we've ever had on High Intensity Health Radio. So I love his approach. And when we did the interview, I think he was like doing yoga or something. It was there was some exercise going on. So it's pretty awesome that he's practicing what he preaches. And one thing that you hit on that I want to take a deep dive into and explore a little bit is sleep. And that's one of the things, working with clients that I found is like a missing link. People, you can Google the right diet. People know avoid the carbs and so forth. But they forget that, coming home and looking at their iPhone and iPad or falling asleep in front of the television. This is a big one that I found that's consistent with clients, and or just not getting enough sleep. And then also skipping breakfast. I found that to be very common in the kind of the classic, like you mentioned, that's type O subtype. So talk to us about the importance of sleep and then what you found with breakfast and breakfast eaters versus non-breakfast eaters. I'm just curious.
Yeah, so first I'll say with skipping breakfast and something that we sometimes recommend called intermittent fasting, those are completely different things. When people skip breakfast, research shows that then they oftentimes shift their circadian rhythms of eating back. So they'll eat their first meal at 11 or 12, their second meal at 5 or 6, and then there's a third meal. And that's where the problem comes in is, they're eating that third meal at 8 or 9 at night, or it's not a meal, it's just sort of this incessant snacking. So they go to the cupboard, they eat something, didn't quite do it. They go back, they get something else, they go back and get something else. And then, it's a sort of 2 hours of just sitting around watching TV, eating more and more food. And that, of course, is not good for the metabolism. So, an intermittent fast strategy, number one, I only recommend doing that once you've shifted your metabolism to be able to burn fat effectively, because now it can be a strategy to help you burn fat as well, but you have to sort of be moving in that direction. Otherwise, people, I find, will eat at night. So, when you're doing intermittent fasting, you want to have that eating window of, say, 6 hours or something, where you're eating lunch and dinner, and then that's it. Really, you don't eat again until the next day at lunch. And that can work for a lot of people. But I think for the average person that, we're kind of talking to today, eating breakfast is a good idea. And I like to get something in within about an hour of waking up. It doesn't have to be huge. It could be a hard-boiled egg and some, veggie sticks, or it could be a small. I don't like to eat a lot in the morning. I like to kind of stay light in the morning. So sometimes I'll do a small protein shake, or I'll do I like to do like omelets. I'll throw some broccoli or spinach in just an egg scramble or in an omelet or something like that in the morning. Sometimes I just eat some veggies with some almond butter or something like that. So just keep it kind of light in the morning. But it is important to start your metabolism sort of revving up in the morning. And protein, I think, is one of the ways to do that in the morning. You get some protein in first thing. So that's important. Oh, there's also there's something called the second meal effect in diabetes, which is interesting. What they found is that your blood sugar will go up less after the second meal of the day than the first. So there's sort of a priming of the insulin release from the pancreas. Mm-hmm. And when you have even just a little bit of food, like a hard-boiled egg in the morning, you get a little bit of, you sort of get the pancreas going, releasing a little bit of insulin. And then when you get to that next meal at lunchtime, the insulin blood sugar metabolism seems to work better. So there are advantages to eating breakfast for people with blood sugar dysregulation like that too. Yeah. I forget what else.
It was about sleep. Yeah, it was just something that I found common.
Yeah, sleep is huge. And number one, it's very overlooked, especially in diabetes care. Standard diabetes care almost never addresses sleep. I'm a certified diabetes educator. We have sort of these 7 things that we're supposed to do with clients. Sleep's not even on the radar. It's like diet, exercise, medication management, foot exams, that kind of stuff, the right testing, looking at their cholesterol and that kind of stuff. Sleep is not really addressed, and sleep is so important. I find this is just a major issue today. And so people go to bed too late, and I'm guilty of that sometimes too, but on average, you get projects and things, and you just have, like right now especially, but you got to get stuff done. You got to have to do it. But on average, you want to get to bed early, like by 10 o'clock usually is the best thing. And then you want to go to sleep and wake up around the same time every day. So I find the wake up time, and I'll do this even if I stay up late. I pay the price and I get up the same time the next morning, because I think it's important to reset that circadian rhythm again. If you start like sleeping in some days, and other days you're up early, some days you're sleeping in late, or you're sleeping on the weekends, your body doesn't know what's going on. It's going to be crazy. And that causes, research shows, insulin resistance. It can make you hungry. It can make you retain weight. It can throw cortisol levels out of balance, which can cause weight retention and can affect blood sugar. So sleep is crucial. Sleep hygiene is really important. Like you mentioned a little bit about this with the computers and TVs. Apple just released on their on the new iPhone operating system that night shift, which is pretty cool. So you can like yellow out your screen a little bit, dim your screen, which is great. I still don't recommend sitting in bed on your iPhone, but but that, at least it's a step in the right direction. So there are sleep hygiene things that you can do. I love morning and evening rituals or routines. So like with young kids, most parents are well aware that their kids are going to do better if they have a routine. They have a morning sort of get ready for school routine. They have an evening get ready for bed routine. And we need that too. So I think it's important to have a routine that leads up to sleep in the morning so your brain knows it's time to shut down. That could be something like turning the lights off, putting some candles on, getting into more dim light, relaxing, reading, praying, meditating, breathing, something like that. A nice bath. You could do an Epsom salt bath with some magnesium and some lavender oil or something like that. But some sort of routine. And I like to make it kind of the same every night, right? So you have this routine, and your brain and your body starts to learn, okay, this is what happens. And at this point, it's time to sort of shut down. And I haven't seen any research. There's probably research out there on it, but it seems like practically that your brain is going to start to learn when to release melatonin. Your cortisol levels are going to start to drop as you get into that evening routine. And then there seems to be a time, most people are well aware of this, where cortisol will rise again if you stay up too late. So it seems to be around 10:30, something like that. Where if you sort of get through that period, cortisol levels can then start to rise, and then you sort of get this second surge of energy. Yeah. But that essentially blocks melatonin and can definitely interfere with sleep. So I recommend trying to get to bed before that little cortisol surge there, before you get that second wind.
Right. So you get that motivation to finish up emails or read that book that you've always wanted to read. Yeah, it's better.
Right, exactly. Yeah, better to wake up early in the morning, right, and set that routine. So, if you're normally getting up at 8, maybe you get up at 6. That can sound crazy for some people, but I'd much rather go to bed early. And really, how productive are you in those later hours? Sometimes you can be, but for the most part, not really. You're tired. Your mind's sort of overwhelmed. And that's the time where you sort of just stare at your Facebook or computer screen, and you're not really getting a whole lot done, unless you like caffeinate or something. So, which I definitely don't recommend. But in the morning, you're bright, you're energized if you have the right morning routine, and you can get a lot done in those hours before people wake up.
Yeah. And that's a great tip, that even if you do, work late, like you're on a deadline, for example, right now, Dr. Brian, and so you're doing a lot of things for the Diabetes Summit, which is awesome and amazing. So you're going to pay the price, but you're going to get up at 6 a.m. or whatever it is, 5:30 every single morning, even if you go to bed late, which is a huge tip, because the natural response is to try and squeeze in extra sleep time, and then your circadian rhythm gets totally misaligned. Then it makes it hard to go to bed at your regular time. Really practical. One thing I wanted to mention, and then we can get into your morning routine, because that's one of the things we like to ask people on the show, Dr. Brian, is melatonin. I read some recent research showing that if people take melatonin at night, it actually helps to normalize blood sugar. It was just a one-off study of like 60 subjects, I think, but I thought that was pretty interesting. And so I want to finish off, if we could, a little bit, obviously diet and lifestyle and exercise, sleep are the core, but there's some good supplements out there. Berberine has a lot of great research. There's some stuff on omega-3s. Can we finish off with some supplements that you found to be particularly effective?
Yeah, for sure. There is some research on melatonin, which is interesting. And I think we're learning more and more about how powerful this hormone is. It's and maybe that's part of the sleep blood sugar connection, is you're not getting that melatonin release if you're not having good quality sleep. But you have to definitely be careful on how much melatonin. With melatonin, more than a lot of supplements, more is not necessarily better. So, I usually recommend about a milligram of melatonin, not much more than that, because there is evidence that if you take too much, it can start to suppress your own production, and that can mess with your sleep cycles as well. But I do think melatonin can be helpful for people. Also, for blood sugar health, you mentioned berberine. That has sort of metformin-like effects. It acts in the cell much the same way that the drug metformin does, which is a diabetes drug, but with less known toxicity. So berberine is I think, a really good option for people. Also, some people with diabetes, metformin is well known for causing a lot of GI distress, and it depletes vitamin B12, which are two things that you don't really want. So a lot of people, it's probably around 20% of people that I see, really either can't take metformin, or it's not that great for them. Like they have issues with it. So for those people, sometimes we'll do a trial with berberine, and if it works, it's great. It can be really helpful. I will say, just because it's a plant compound, doesn't mean it's completely safe. We can take as much as we want. You do have to be careful. And I recommend cycling on and off berberine. So maybe 6 weeks on, 2 weeks off, something like that, just to give the liver a little bit of a rest. But it can be a great strategy. And I think in the long run, a really good option for people who have high blood sugar. There's minerals like chromium and vitamins like biotin, which have been shown to improve glucose tolerance. Apple cider vinegar is something that seems to help just about everything, but can help blood sugar as well, having some apple cider vinegar before a meal. Cinnamon is one that I want to mention because a lot of people have heard that cinnamon's effective. And a lot of times I encounter clients who are taking, 1 or 2 capsules of cinnamon per day, which is like 500 or 1,000 milligrams of cinnamon. That would be like sprinkling some cinnamon, on some food. It's not a whole lot, and really at that level is not therapeutically effective. So cinnamon can be good, but you have to get up into about the 8 to 10 gram per day range, which is about 2 teaspoons. And we recommend using, if you're going to use that amount, you want to use that Ceylon cinnamon, which is, you have to kind of order online, get a health food store. You can get it on Amazon. But Ceylon cinnamon in a powder form, it's got a nice taste to it. It's safe, so it doesn't have the toxicity that over-the-counter cinnamon cassia can have, which is what's in the like spice rack. And that can be very effective at reducing blood sugar and lipids as well. So it's got other benefits. So cinnamon's a really good one. And then one other one I'll mention is there's an herb called Gymnema, Gymnema Sylvestre, which is kind of a lesser known herb, but it's been shown, there's been lots of studies on it. It's been shown to do several things, which I love. One is to help preserve beta cell function in the pancreas and even regenerate beta cell function in the pancreas, so insulin production. It's been shown to improve insulin resistance, and you can actually open a capsule and put a little bit on the tongue. It's been shown to reduce sugar cravings. And a lot of people, they want to eat better, they know they need to eat better, but they've got these sugar addictions or strong sugar cravings, and they just can't seem to get past that. A little bit of that Gymnema on the tongue several times a day, like 3 times a day, can help to curb sugar cravings. And there's data about that as well. It seems to be very effective.
One of the final questions that we do ask is your favorite herb, nutrient, or botanical. So we'll figure out which one is your favorite.
Okay, sure.
I want to learn your morning routine, Dr. Brian. We know you're a very successful practitioner. You're doing a lot of stuff online, really helping to spread the awareness and knowledge. And so we want to know how you are able to do so much in a short period of time. So what does your morning routine look like?
Yeah, and I've got 4 kids too. So this is really important for me, because if I don't have the right morning routine, I could get nothing done. And I see clients. So, it's like, I could if I don't do the right thing in the morning, I could get the kids off to school ready, get in the office, be on the phone or Skype until, 6, 7 o'clock at night, come home, get the kids fed again and be ready for bed and get 0 done. So the morning routine is a great question because it's really important to me. So I like to get up early, right around 6. And that gives me about an hour, hour and a half of free time. So I'll do a little bit of prayer, a little bit of meditation. That's important to me. I like to start my day that way. 5-10 minutes. And when I talk about meditation, it's not like transcendental meditation or anything fancy. I just will sit, I'm sort of still a little groggy. I'll kind of go downstairs and I'll find a comfortable place, usually around the same place every day. And I'll sit and I'll just sort of close my eyes upright, breathe, focus on my breath, and just sort of get centered. Get mindful. So it's a form of mindfulness meditation, really. And then I'm a coffee drinker, so I do a double shot of espresso because that's my thing in the morning. I like my little espresso drink, and then I get some exercise in. And there's actually research on fasted exercise, and I don't know if you're a fan of caffeine or not, but there's also some evidence on caffeine improving lipolysis or breakdown of fat during exercise, during fasted exercise. So that's my excuse for taking my double espresso in the morning. But I like to do a little exercise. Sometimes it's yoga or something relaxing. Usually it's a little bit more energizing. So I do these things called 10-minute blood sugar burners, and they're basically like body weight exercises, different forms of squats and lunges and push-ups and pull-ups and that kind of thing. So I'll do somewhere between 10 and 20 to 30 minutes maximum of a blend of sprint cardio and body weight exercises, essentially. Sometimes I'll use some dumbbells, but basically do that 6 days a week. And then Sundays, I basically do a longer prayer. So I don't do the exercise. And then I get showered and ready for the day. So that's it.
Then it's rock and roll.
It's rock and roll.
Yeah, 4 kids. I can only imagine. And for the record, I am a huge fan of caffeine, by the way, especially pre-workout. For like you mentioned, the lipolysis, lipolytic effect. But what I like about it too, Dr. Brian, is how it kind of blunts the pain response. So you can do a better workout, and it doesn't feel that you're putting out. Because a lot of people, when they're first getting into exercise, their pain tolerance is relatively low, and I think it gets better over time with exercise. But caffeine can kind of shorten that learning time. So. Yeah. I love that. Now let's go back. Go ahead.
I was just going to say, it sounds strange, but I love caffeinated yoga too. Like I'll do a double shot of espresso and then get into like a yoga routine. And I don't know, it's just like, there's nothing like it. I love it.
Awesome. I'll have to experiment with that. For some reason, I feel guilty having caffeine before yoga. For weights, for sure. Hiking, caffeine, no. But yoga, I feel like I should be zen before I even go in. But you're right. I mean, I could see how it would affect, holding the poses, getting into the breathing, that mental beauty.
It's like hyper zen.
That's awesome. So let's talk now about your favorite real whole food. And this can be like literally a food group, a dietary supplement, an ingredient, something that you feel so powerful for how it regulates and affects blood sugar. If you could just pick one thing, what would that be and why?
Well, I don't know if it's going to be about blood sugar, but I'll tell you my favorite is I love green drinks. Now, this is a little bit of a cheat because there's usually a lot of stuff in a green drink, but I love just a powdered green drink. I do that. I'll throw a scoop of greens in my smoothie. I'll throw a scoop of greens in some water and drink it a couple times a day. I get so much energy and so juiced off of that plant life basically in there. And I use one that's got, again, tons of stuff in it, but if we want to just say one, I also like, sort of on a similar path, Chlorella. So I get those little Chlorella tabs, and I'll chew like 5 or 10 of those a couple times a day. And I think they actually taste good. A lot of people don't agree with me, but I kind of like them. And immediate energy, just feel great, and just it feels like you're just like taking the life of that plant, and it's like nourishing your blood immediately. So that's sort of the one that there's lots of things for diabetes, but for wellness purposes and just I think that anybody can and should do, it's a good plant-based food supplement like a green drink.
Yeah, really powerful. You have really vibrant, clear skin. I met you in person too about a year ago, so that was one of the first things I noticed. So maybe there's something about the Chlorella and your morning routine that's affecting that. So keep it up, Brian. That's awesome. So if you were to meet a politician of sorts, whether it's a current president, someone from the World Health Organization, and just had a little bit to bend their ear because they had the potential to influence policy, what sort of health lifestyle tip, something about nutrition, what would you want them to know about and why?
Yeah, I think we need to, as a culture, take health seriously, right? Like we've got this war on drugs that's spanned decades. We've got this war on poverty, and these are all, of course, important things. I mean, they're great causes. You look at healthcare reform, which is really disease care reform, but we're trying to fix our healthcare system. We're trying to fix all these things: homelessness, again, drugs. Now it's immigration. All these things are big issues, but rarely, I don't think I've ever seen anybody really stand on not healthcare but health. And to me, that's where it all starts. If we could take our health seriously, people, you can tell just by looking around that very few people take health seriously. I mean, there's junk foods and sweets and potato chips and, high calorie, low nutrient density foods everywhere, out on every desk, in every office. If we could do the same thing with those foods that we did with cigarettes as a culture, over the last 30 years, I think our culture would completely transform. And it's not just preventing disease, it's about optimizing performance and potential, right? I mean, I know that the healthier you are, the better you're eating, the more you're exercising and taking care of yourself, the better you're managing your stress, you're getting these morning and evening routines down, you're sleeping well. I mean, everything's better. Your relationships are better. You feel better. Your mind is more clear. You make better decisions. You tend to be just a nicer person. I think if we could take health seriously, I think a lot of those other things, like, healthcare, certainly that's a big one, but also, even things like poverty and, all the other things that I mentioned would get better, because almost everything, I believe, really starts with our health.
Mm-hmm. Yeah, crime and mental illness and, pain. I mean, there's so many things that loss of mobility and disabilities we can dive into. That's a really powerful, the way that you articulated that is very powerful, Dr. Brian. I like that. So you've been doing this diabetes summit for many years now. I think this is the third or fourth year that you've done it. You have a lot of different experts. What are some highlights of this year's diabetes summit, and when can folks tune into that, and what can they expect?
Well, shameless plug here, but your talk, Mike, was awesome. It's like, seriously, definitely one of the top 2 or 3 interviews that I did. And we talked just about gut hormones and the gut and a lot of things that weren't hit in other summits. So I definitely recommend people to watch your interview. The one I did with Ben Greenfield yesterday was another awesome one. I interviewed Dr. Robert Lustig, who you can find him on YouTube, talking the sugar, the bitter truth, and he has a book about that as well. He's one of those guys, you sit down, he's got no notes, he just sits downstairs at the computer and just like, it's just like knowledge, like David Perlmutter's another one. He opens his mouth and brilliance comes out, right? And this guy was the same way. So he was just awesome. Dr. Mark Hyman is another great one that people are going to be familiar with. And he has the new book out about fat, and he's just on a rampage with trying to get people to eat healthy fats again, which is awesome. And when he gets behind something, things usually get done. So it's pretty cool. But we had we had an interview about gestational diabetes, which was interesting. We had some dietitians on who are not, your conventional dietitians, talking about low carb, ketogenic style diets. We had a great interview with Sarah Gottfried, all about hormones. Another really engaging, powerful interview. We had a great interview about sleep. And sleep quality with Sarah Ballantyne, Paleo Mom. So I would definitely check those out, and they're all good. It's so much fun doing those, because I mean, just in the months that it takes me to do all those interviews, I learn so much, and it changes the way I interact with clients, and people are going to learn that from sitting through those over the course of a week. And that's April 18th it starts, so pretty soon.
Yeah, by the time folks listen to this, it will be available to register and sign up. So folks can do that at highintensityhealth.com/diabetes. We'll have the show notes to Dr. Brian's talk today, links to the Diabetes Summit, and also the video version of this interview. So if you're listening over in iTunes, thanks for tuning in, but you can also watch this discussion over on YouTube, and again at highintensityhealth.com/diabetes. So Dr. Brian, I really enjoyed talking with you. This was awesome. I learned a lot of practical tips. And I think the big take home for me is to look for, I have this True Test glucometer, which is like, it's a Walgreens private label thing. I don't know how accurate it is, but I want to get that Neo.
Yeah, get the Neo.
Yeah, I think that's a really great take-home tip. And like you mentioned, it's really inexpensive. For under $40, you can have, blood sugar testing at your fingertips literally for months. So why not do it?
Thanks, Mike. This was a lot of fun. Appreciate you having me on.